All right, good day, students. So for today's topic, we're going to be discussing about NVS or Neurovital Signs. No, so since our topic is about the ICU as a level 4 nursing student, so you have to be aware on how to assess your neurovital signs. All right, so let's proceed. Now, neurologic system. So, a thorough neurologic examination may take 1 to 3 hours. However, routine screening tests are usually done first, di ba? So, usually, when you do a health assessment, you do the whole health assessment first, no? In general. Then, if you see something that's something uh, that you notice in the neurologic status of the patient, then that's the time that you have to take into consideration to assess further the neurologic status of the patient. All right. Now, if the result of these tests raise questions, no, more extensive evaluations are made. So if you see that the patient's consciousness has a problem, orientation or memory, then by that time you have to start, no, extensive evaluation of the neurologic system. Now, there are three major considerations to determine the extent of neurologic exam. So what are they? One is the client's chief complaint. Now, if you receive a client that is, let's say, been through a vehicular accident, so you assess that client, that there's a possibility that that client has a problem in the neurologic status, or if the chief complaint of the client is stroke, so meaning there's a possibility that that patient has a neurologic problem. Now, if the patient came in with, let's say, vomiting, no? So meaning there's no need for you to conduct a neurologic exam when it comes to the patient's complaint of vomiting, kasi hindi naman yun, parang hindi naman related ang neurologic status ng pasyente sa kanyang chief complaint. All right? So that's one. Next is you have the client's physical condition. Example, the level of consciousness and the ability to ambulate. No, so because many parts of the examination require movement and coordination of the extremities. Now, if you see the client, no, the patient that is the level of consciousness of the client is, for example, unconscious yung client pagdating niya sa hospital, no? So you have to assess the neurologic status of the patient. If the client is drowsy or confused or answers in an inappropriate way, so you have to assess the physical condition or the neurologic status of the client. Now, also, if the client is not able to ambulate, hindi siya nakakalakad ng maayos, hindi nakakatayo ng maayos, no? So meaning, you know that the part of the brain that's responsible for that is your cerebellum, di ba? For balance and movement. Now, if the client is not able to move, no? Is not able to move, is not able to balance, therefore, baka may problema yung kanyang cerebellum. So you have to, again, focus on assessment on your neurologic status of the patient. All right? Number three, the client's willingness to participate and cooperate. Now, very important that you have to have a client that is willing to participate and cooperate, because if the client is not willing to cooperate, no, kahit anong gawin mo, kahit anong sabi mo, ma'am, sir, can you open your eyes for me, no? So the client will not participate and will not open her eyes or his eyes, no? So you will have a false result, no? So hindi mo naman pwedeng isulat na no eye opening, no? Even though you know that the client is able to open his eyes and able to follow command, no? So kaya important talaga yung participation and cooperation ng client, no? So again, the three considerations to determine the extent of neurologic exam, you have first your chief complaint, no? If possible na yung nangyari sa client, your problema ng client is makaka-apekto sa kanyang neurological status, then you have to do extensive evaluation on the neurologic exam. Then the client's physical condition, no? You assess the level of consciousness, no? And ability to ambulate. Kasi nga, our brain is responsible for our level of consciousness and our ability to move. And third, you have the willingness of the client to participate and cooperate with your examination. Those are very important. All right? Next, so examination of the neurologic system includes assessment of ano ba yung mga ini-examine when it comes to the neurologic system. We have mental status, including the level of consciousness. All right. Then we have the cranial nerves. So I hope that you still remember your cranial nerves. No? Type in the chat box how many cranial nerves do we have. All right. Sige, type in the chat box. So we have 12 cranial nerves, no? So mamaya we will check, no, or we will see if memorize nyo pa yung mga cranial nerves na yan. Right? We have our reflexes, then we have motor function and sensory function. So those are the five uh, examination or assessments that will be done, no, para sa neurologic system. So we have mental status, cranial nerves, reflexes, motor function, and sensory function. All right. Next. So parts of the neurologic exam or assessment are performed throughout the health examination. So example, no, when you are talking to the patient, no, observing the patient, asking for the history of the patient, no. So by doing that, you're already looking at the general appearance of the patient. You are now able to see if meron bang abnormality in balance or gait, or is the patient awake, no, or the mental status of the patient. Is the patient able to talk with sense, no? Oriented ba yung patient kung nasan siya? Kilala ba niya yung sarili niya? Does the patient know her name, her birthday, her age, no? Sino yung kasama niya? Yung pangalan ng watcher niya, and things like that. Then also, the nurse assesses for the functions of the cranial nerves 2, 3, 4, 5, and 6. No, so if the is the ophthalmic branch with the eyes and vision, the cranial nerves 8 with the ears and hearing. No, so we have the cochlear branch for the hearing. Mamaya we'll dive deeper with the cranial nerves. No, now, unahin natin yung mental status, di ba? So, yung una on the list, we have our mental status. So, how do we assess for mental status? So, assessment for the status reveals the general cerebral function, no? When you say cerebral function, this is responsible for your, di ba? What function does the cerebral part of the brain do, no? So can you answer? Do you have any clue? Can you type in the chat box? What's the function of the cerebral or the cerebrum? All right. So meron tayong clue dito. Ito yung clue number 1 and clue number 2. Yan. All right. So these functions include, we have our intellectual or cognitive function, and then we have our emotional or affective function. So yun yung function ng ating cerebrum, di ba? It's responsible for our thought process and also our emotional process. All right? So if problem with the language, memory, concentration, or thought process are noted during the nursing history, a more extensive examination is required during the neurologic assessment. Like I said, no, if nakitaan nyo, no, na may problema yung patient in terms of language, memory, concentration, and thought process, no, during your history taking. So therefore, you know that the language, memory, concentration, and thought process is being done by the brain, di ba? So it's being done by the brain. Therefore, if there's a malfunction in those functions, therefore there's a problem with the brain. Therefore, you have to do a more extensive examination in your neurologic assessment. All right. Now, major areas of mental status assessment include, ano ba yung mga major areas for mental status assessment? You have language, orientation, right? So we have language, orientation, memory, attention span, and calculation. So mamaya isa-isahin natin. Paano ba natin i-assess yan, sir? No, so we will assess that later. Okay? So now let's first tackle language, no? So type in the chat box, sino yung Hollywood actor na kilala ninyo na may problem sa language or aphasia, no? Ito, aphasia. Sino yung Hollywood actor na may aphasia? Anybody? Okay, type in the chat box, no? If kilala nyo, bago lang yan siya na medyo matanda na siya na Hollywood actor, no? So it's actually Bruce Willis, 'di ba? Bruce Willis. So What is aphasia, sir? Ano pala yung aphasia? So, any defect in or loss of power to express oneself by speech, writing, or signs, or to comprehend spoken words, written language due to disease or injury of the cerebral cortex is called aphasia. Diba? So, ulitin natin, no? Ibig sabihin, defect, loss of power, no? Or hindi niya kaya, no? Unable to express oneself through speech, writing, or signs, no? So, hindi niya masabi, hindi niya masulat, hindi niya sign language, yung gusto niyang sabihin, that is aphasia. Also, hindi niya maintindihan ang sinasabi mo, ang sinusulat mo, or yung hindi niya maintindihan yung binabasa, that is also aphasia. Ibig sabihin, no, that there is a disease or an injury in the cerebral cortex of the brain. Because the cerebral cortex is responsible for interpreting words, no, words and written languages sa ating environment, no? So hindi niya ma-decipher, hindi niya ma-process yung mga bagay na yon. Alright? So we have two types or two categories of aphasia. We have sensory or receptive aphasia, and then we have motor or expressive aphasia. When you say receptive aphasia, no, for example, dito, example number 1, no, receptive aphasia. When you say receptive aphasia, it means to receive, no? Receive. Ibig sabihin, hindi niya kayang i-understand, no, or i-comprehend yung mga tinatanggap niya. So paano ba siya tumatanggap? You have your when the individual has trouble understanding what is being said, no? Or what is written, hindi lang naman sa ano yan, sa sinasabi. What is written, no? So cannot understand, no? That is now receptive aphasia. Now when you say expressive, no, number 2, expressive, cannot express, no? So is not able to express. How? Has difficulty expressing what they want to say, no? Or cannot write, no? Or write, or sign languages. Hindi niya magawa yan. So that is the expressive aphasia. All right? So again, two primary categories. You have your sensory or receptive aphasia. So we have here. And then second is your motor or expressive aphasia. All right? Now, we have sensory or receptive aphasia. No, it is again the loss of the ability to comprehend written or spoken words. No, so we have two types of sensory aphasia. No, so first we have auditory, no, auditory aphasia or acoustic. Ibig sabihin, the client, no, is not able or lost the ability to understand symbolic content associated with sound. Alright? So, ibig sabihin, hindi niya maintindihan, no? Hindi niya maintindihan ano yung mga sinasabi ng ibang tao through sound. Kasi, hindi ma-process ng brain niya yung sound na yon. For example, pag sinabi kong dog, automatic na ang pumupunta sa isip nyo is aso, di ba? Or dog. No, whatever dog you can think of, no, pet nyo sa bahay. Pero aso talaga yung pumupunta sa brain niyo, no? Now, in clients with auditory aphasia, hindi nila maintindihan ang dog, ang sound na dog. Hindi nila ma-interpret yan. For example, ang naririnig lang nila is, oh, oh. So, pag sabi mong dog, sa kanya is, oh. So, hindi niya maintindihan, hindi niya ma-interpret kung ano yung sinasabi mo. Alright? That's your acoustic or auditory aphasia through sound. Right now, visual aphasia naman. So, when you say visual aphasia, no, so the client is not able to understand printed or written figures. Now, ibig sabihin, lost the ability to understand printed or written figures. So, hindi niya kaya intindihin or basahin yung mga sinusulat, no? So kaya doon siya nagkakaroon ng problema. Alright? So again, two types of sensory aphasia. You have your auditory and you have your visual aphasia. Alright? Next naman, yung motor naman or expressive natin, no? Meron siya problema to express, no? So ano ba yung mga problema niya? Number one, hindi hindi niya kayang isulat yung gusto niyang sabihin, no? Hindi niya kayang isulat, then making signs, hindi niya kayang mag-make ng sign languages, and then hindi niya kayang magsalita. All right? So every time nagsasalita siya, nagde-jumble yung words niya kasi yung brain niya, no, which is responsible for making or organizing speech, has a problem. May problema. Kaya yan yung nangyayari. All right? Now, let's proceed to orientation. When you say orientation, uh, what do you mean by orientation, no? So, ibig sabihin, oriented ba yung patient? Alam ba niya, no? Alam ba niya ang mga bagay-bagay sa paligid niya? That's orientation, di ba? So, how do we assess this? Now, this aspect of assessment determines the client ability to recognize other people. So, una, kilala ba niya yung ibang tao? So, paano mo ito i-assess sa patient? No, sir, ma'am, good morning po. Um, Kilala niyo po ba yung kasama ninyo? Ayun, so, yes, watcher ko yan. That's my husband, si ganyan-ganyan. That's my wife, ganyan-ganyan. Anak ko yan, ganyan-ganyan. Or pinsan ko yan, ganyan-ganyan. No? So, kilala niya. But you also have to verify, no, sa watcher kung tama ba yung sagot niya, di ba? Ma'am, totoo ba na tama ba yung sinabi niya, ma'am? Yes, no? So yan, orientation. Next is awareness of when and where they presently are, or time and place, no? So ibig sabihin, tatanungin mo yung patient, ma'am, do you know where you are? Sabi, yes, I'm in the hospital, no? So, do you know what time it is? No? So, it's around 10 a.m., I think, no? Or, I'm not, kung hindi sila sure sa oras, no? Pwede naman nilang sabihin, I'm not sure with the time, but I think it's still morning. So, yan. So, ibig sabihin, aware pa rin siya kung anong oras, no? So, very important to assess orientation. Because some patients, if they have problem, no, they've been into a car accident, for example, tapos natamaan yung ulo nila, no? So when you ask them, sir, do you know where you are? I don't know. Where am I, no? So hindi nila alam saan sila, or do you know what time it is? So hindi pa rin nila alam. So ibig sabihin hindi na sila oriented kung saan sila. All right? Next is on who they and themselves are, no? Or self. So you have to ask the patient also, ma'am, ano pong pangalan nila? Na ano pong pangalan nyo? So usually anong pangalan nyo? Anong birthday nyo? Ayan. So you also have to verify this, no? Through the checking the wristband of the patient. All right. Now, in the term disorientation or confusion are often used synonymously, although there are differences. That's why it is always best, no, to describe the client's action and statement than label them. So, for example, hindi mo pwedeng sabihin na the client was disoriented or confused, ganyan lang, no? So you can write the client was not able to answer uh, uh, correctly the time and place, no, where he is, and what time it is. So i-describe ninyo doon para mas specific. All right? Now, let's talk about memory. When you say about memory, the nurse assesses the client's recall, no, of information presented seconds previously, no? So immediate recall ang tawag diyan. Ibig sabihin, when you talk about memory, the patient recalls information presented, no, seconds previously. Tawag diyan immediate recall. So, lagay natin dito, immediate recall. Yan. So, how do we assess immediate recall, no? To assess immediate recall, madali lang. Ito lang yung gagawin natin. Ask the client to repeat a series of 3 digits spoken slowly. For example, ako yung nurse, no? So, ma'am, good morning po. I would like to test your immediate recall. So, meron akong sasabihin po sa'yo, then tatlong digit na number, then ulitin niyo sa akin. This is to test your memory po. Of course, you have to also explain to the patient what you are doing and why you are doing this one, no? So, para naman malaman ng patient, the patient will know why you are doing this. Baka naman iniisip ng patient you're just playing games, no? So, ganyan. So, ma'am, for example, 374 o 374, sabihin ng patient, okay po, 374. Okay, so yan. So, after mo sinabi sa kanya yung number, sasabihin niya sa iyo ulit yung number. Then, no, yan yung unang step. Pangalawang step, you gradually increase the digits, no, from 4, 5, 6 until the client fails to repeat the series correctly, no. So, ma'am, 7435. So, sabihin ng patient, okay? 7435. Yan, ganyan, no? So, or, ma'am, 5612. So, sabihin ng client, 5612. Okay? So, okay, increase natin, ma'am. 56213. No? So, sabihin ng client, 56213. Then, and so on and so forth. Alright? Pataas, padami yung number. Now, paano mo malalaman kung ano yung abnormal, no? So, dito yan siya. Now, start again with a series of 3 digits, but this time, the client, meron pa rin isang way, no? So, lagyan natin number 3. Repeat them backwards, no? Meron din isang way. For example, 1, 2, 3, no? 1, 2, 3. Tapos sabihin ng client, 3, 2, 1. Yan. So, backwards, no? So, that is immediate recall kasi sinabi mo sa kanya and then i-recall niya agad-agad, no? So, an average individual, no, can repeat a series of 5 to 8 digits in sequence. So, ibig sabihin, eto sa 1 and 2, no, sa 1 and 2, so for 1 and 2, all right, kaya niya mag-repeat ng 5 to 8 digits, no? Hanggang 8 digits, no? From 1, 2, 3, 4, 5, 6, 7, 8. Okay, 1, 2, 3, 4, 5, 6, 7, 8 yan. Kaya niya yung i-repeat, no? Uh, or i-jumble mo yung 1, 2, 3, 4, 5, 6, 7, 8 na para mas mahirap. Then, in terms of backwards, so the client is able to remember 4 to 6 digit in reverse. Alright? So, in reverse. Yan. So, we have 4 to 6 digits in reverse. So, ito, in sequence, ito naman in reverse. Alright? Yan. So, that's how to test your immediate recall. Right? Next is events or information from earlier in the day or examination. So, pag sinabing memory from earlier in the day, ang tawag na dyan is your recent memory. Alright? So, sulat natin dito, recent memory. Alright? Recent memory. Now, when you say how to assess recent memory, now sabihin natin, ask the client to recall recent events in the day, such as how they got to the clinic, no? But this information must be validated, however, no? So, sabihin mo, ma'am, paano po kayo nakapunta sa hospital? Sabihin ng patient na, ano po kami, nagsakay kami ng taxi. Kung ganyan, no? So, tanungin mo yung watcher, totoo po ba ma'am na you rode the taxi papunta dito sa hospital? And then the watcher will say, yes po ma'am, no? Or sabihin niya, hindi po yung taxi ma'am, nag-jeep po kami. So, yun, baka confused ang client, di ba? Or hindi po ma'am, naglakad lang po kami dahil malapit lang po yung bahay namin. So, things like that. You have to confirm the answer of the patient. All right? Now, you also can ask to recall information given earlier in the interview such as the name of the doctor. Di ba? Usually po, ang ginagawa, ma'am, good morning po. Ito po si Dr. Let's say, Dr. Alfonso. No? Sabihin niya, Dr. Alfonso po yung doktor ninyo. So, wag niyo pong kalimutan yung pangalan niya, ma'am, ha? Then, after your 7 hours or 8 hour shift, no? So, pupuntahan mo ulit yung client. Ma'am, kilala niyo po ba yung doktor niyo? So, sabi niya, yes po, si Dr. Alfonso. So, ibig sabihin, maganda pa yung recent memory ng client ninyo, no? Or, you can provide the client with three facts to recall, no? Example, color, object, and address, no? Or a three-digit number, and ask the client to repeat all three later in the interview, no? Ask the client to recall all three items. For example, sabihin natin na sky blue, tapos cellphone, and General Malvar Street, Davao City. So, yun yung tatlong sasabihin mo sa client. Ma'am, I will try to, meron akong sasabihin sa yung tatlong bagay. After the interview, tatanungin ko kung maalala mo sila, no? So, we have your sky blue, cellphone, tsaka General Malvar Street, Davao City. Alright? So, yan. That's how you assess your recent memory. Okay? And knowledge recalled from months or years ago, pag sinabing months or years ago, ang tawag dyan is remote or long-term memory. No? Pag matagalan na. So, sulat natin dito. So, you are remote or long-term memory. Yan. So, pang matagalan na. So, how to assess this? Usually, you ask the client to describe, no, general illnesses or surgeries 5 years ago, no, matagal na 5 years ago. Or for example, birthday or anniversary, you know, ma'am, ano yung regalo ni sir sa inyo nung anniversary? Last year, no? Or 5 years ago na anniversary, mga things like that. Or saan ka nag-birthday 5 years ago, for example, no? So, nag-birthday kami sa sa bahay lang, ganyan. So, ganyan, no? So, long-term memory. Generally, remote memory will be intact until late in neurologic pathology. It is at least useful in assessing acute neurologic problems. So, ibig sabihin, no? Ibig sabihin, pag hindi pa late yung neurologic pathology, intact pa yung intact pa yung memory, yung long-term memory. So, malalaman mo na, okay, dahil intact pa yung long-term memory niya, acute pa ang neurologic problem niya. Hindi pa ito sobrang tagal. Alright? Okay? So, let's pause ko muna sandali. All right, let's continue. No, so next topic we have attention span and calculation. So, sir, how do you assess for attention span and calculation? No, so this component determines the client's ability to focus on a mental task that is expected to be able to be performed by an individual with normal intelligence. No, so 'di ba minsan meron tayong mga patient na tinatawag na ADHD, no, or we have yung hindi nila kayang mag-focus sa isang bagay. No, so you have to assess that aspect of the patient also. No, so how do we assess attention span and calculation? So we have here, in terms of assessing for concentration or uh, concentration or to maintain attention span, you ask the client to recite the alphabet, no? So A, B, C, D, A to Z, no? And then, or count backwards from 100, no? So 100 to 99, 98, no? So and so on and so forth. So dapat matapos 'yan ng patient, no? Kung hindi 'yan matapos ng patient, ibig sabihin meron siyang problema sa kanyang attention span. Hindi niya kayang tapusin ang isang task na matagal, no? Kasi maikli masyado yung attention span ng patient na 'yon. So that's how you test for the attention span. Now, how do you test for the ability to calculate? No, ano bang i-calculate dito, sir? Algebra or trigonometry? Hindi naman, no? Simple mathematics lang naman, no? Like subtracting 7 or 3 progressively from 100. For example, ma'am, uh, count the numbers 100 pababa, subtract mo lang yung 3, no? Or subtract mo lang yung 7. For example, 100, 93, 86, 79, and etc. So kung 3 naman, mas madali, 100, 97, 94, 91, so ganyan, no? 88, 85, so and so on and so forth. A task that is referred to as serial 7 or serial 3s, no? Ang tawag dyan sa calculation. So, when you say calculation, you have your serial 7 or serial 3. All right? Serial 3s. Okay? Now, normally an adult can complete the serial 7 in about 90 seconds with 3 or fewer errors. All right? So, ibig sabihin, 90 seconds with 3 less than 3 errors, no? Equal to 3 or less than errors. All right? Now, because we have to consider the educational level, no, of the patient, or the language or the cultural difference of the patient, we also have to take that into consideration that this test, no, may be inappropriate for some people, no? So hindi siya appropriate sa lahat. For example, yung patient ninyo is elementary graduate lang, no, or for example badyaw ang inyong patient, so hindi siya makaintindi ng English, Tagalog, no? So dili balo, badyaw, badyaw, no? So, hindi niyo siya ma-assess. All right? Next is the level of consciousness. Now, in terms of the level of consciousness, we have our Glasgow coma scale, no? So, this was developed by Glasgow. So, the level of consciousness can lie anywhere along the continuum, no? From the state of alertness to coma. Ibig sabihin, when you say a continuum, ito yan, continuum, this is your alertness to coma. So, alertness, then coma. So, this is the continuum of your level of consciousness. All right? Now, a fully alert client responds to questions spontaneously. A comatose client may not respond to verbal stimuli. All right? So, mamaya malalaman natin, ano ba yung comatose, no? So, when somebody says, comatose si patient, ganyan, or comatose katong silingan na to, kay comatose na. So, ano ba talaga ang ibig sabihin ng comatose? Right? So, according to Glasgow Coma Scale, but it was originally developed to predict recovery from head injury. However, it is used by many professionals to assess level of consciousness. Excuse me. No? So, level of consciousness. Now, in test, it tests three major areas. No? We have the eye response, the motor response, and the verbal response. An assessment totaling of 15 points, no, indicates the client is alert and completely oriented. Pag 7 naman or less, ibig sabihin comatose. Alright? So, a score of 15 is uh, perfect, no? Then a score of 7 or less is considered comatose. Alright? So, we have eye opening, motor response, and you have your verbal response. All right. So you have your verbal response. Now, uh, when you say spontaneous, no, I will show you a video after this, no, para makita ninyo how these are assessed, no. Uh, Eye opening, pag halimbawa pagpasok nyo sa kwarto ng pasyente tapos mata ang pasyente, no, the eyes are open. So that's spontaneous, no? So you will give it a score of 4. Now, when upon entering the room of the patient, you saw that the patient's eyes were closed, no? Or let's say natutulog ang pasyente, whatever, basta naka-close yung kanyang mata, no? Then you ask the patient, "Good morning, sir. Can you open your eyes po for me?" No? Or say, "Good morning, sir." Tapos nag-open siya ng eyes. That is to verbal command, no, or to sound, no, verbal command or to sound. Then if hindi mag-open yung eyes niya, "Sir, good morning po. Can you open your eyes for me?" And then the patient was not able or is not opening his or her eyes. Ano yung gagawin mo? You apply pain, no? Apply pain to the patient. How do you apply pain? Kusion ba ni ang patient? No. No, you do not apply pain to hurt the patient deliberately, but just to assess, no? Dili siya kusion, no? Sa video mamaya ipapakita doon na uh, using your pen, and then sa fingernails, sa nail bed, ipiton ang nails, no? So pag ipit sa nails, no, for about 10 seconds, increasing ang pressure, no, to assess for responsiveness to pain. Now, if mag-open ang kanyang eyes, no? So if open ang kanyang eyes to pain, ibig sabihin you will score that 2, no? And then if hindi naman mag-open yung kanyang eyes, even if nagbigay ka na ng pain, so that is now no response, and then that is a score of 1. All right? Next, we have a motor response, no? Motor response is a uh, they obey verbal command, no? Mamaya ipapakita din paano mag-response to motor response, no? So you will ask the client, "Ma'am, can you squeeze my hand po?" No? So kung obey siya, so that's obeying, no? So to verbal command, and 6 yan siya. If hindi niya kayang i-obey yung commands mo, so upon inflicting pain, the patient will try to localize or tatanggalin niya kung saan yung pain na nag-present ka ng pain, no? Alam niya kung nasaan yung pain. Ibig sabihin, localize yan, so that you will score that as 5. And if flexes and withdraws, so buong katawan niya yung gumagalaw, hindi niya alam kung nasaan exactly yung area of pain, ibig sabihin, you will score the patient 4. And flexes abnormally, also known as your decortication, no? Mag-ana ang kamot sa patient sa padulong sa papunta sa gitna, core. So you will score 3. And then if it extend or decerebrate, you will score it 2. If wala namang response, again 1. No? Verbal response, if the patient is oriented, alam niya kung nasaan siya, alam niya yung pangalan niya, place and time, that's 5. If confused siya, disoriented, or also confused, no? Hindi niya alam kung nasaan siya, 4. Or sino siya, or sino yung kasama niya, or makes inappropriate words, uses inappropriate words, or hindi tama yung sagot niya, that's the score of 3. And if makes incomprehensible sound like hindi mo maintindihan yung sagot niya, that's 2. And if no response, that is 1. All right? Now, what is the lowest score of the Glasgow Coma Scale? Anybody? What is the lowest score for Glasgow Coma Scale? So, the lowest score is 3. All right? So, 3 yung pinakamababa. Walang 0. All right? So, let me show you a video on how the Glasgow Coma Scale is done. All right? Let me share the video. Sandali lang. Stop share muna ako. Okay, so here's a video of how to assess your Glasgow Coma Scale.
Clinical assessment of consciousness is often crucial in the care of a patient with an acute brain injury. This film will provide you with a practical guide to using the coma scale that we developed in Glasgow to ensure reliable assessment and clear communication about the patient. We'll show you how to make a series of standard observations of 3 aspects of the patient's responsiveness: eye-opening, verbal, and motor responses to stimulation. Steps in each component can be rated according to defined criteria to show the degree of impairment present. We'll show you how to record and communicate your findings, how these can be used, and provide you with a downloadable summary.
When assessing a patient, there are 4 steps. check, observe, stimulate, and rate. The preliminary check is used to identify any factors that might interfere with your assessment. It is important to identify local factors, such as a hearing impairment, that could cause a lack of capacity to respond. Following these preliminary checks, we observe the patient, noting any spontaneous behaviours in any of the three components of the scale: eyes, verbal, or motor. The patient is rated in each component by matching findings with the corresponding criterion. There are 4 criteria for eyes, 5 for verbal, and 6 for motor score. For each component, the top criterion is a normal response, whilst the lowest criterion is no response. If the patient's eyes open spontaneously, spontaneous is recorded. Remember, there may be local factors, such as swelling, that prevent eye opening. If spontaneous opening is not demonstrated, a verbal stimulus is used by introducing yourself clearly and requesting eye opening, if necessary by shouting. If the patient opens their eyes, to sound is recorded. If the patient does not open their eyes when you speak to them, a physical, peripheral stimulus is then applied. Stimulation starts at a low level by pressing on the nail tip, and is applied with increasing intensity for up to 10 seconds, until the patient demonstrates a response or until maximum stimulus has been applied. If the patient opens their eyes, record to pressure. If they do not open their eyes, record as none. If there are local factors, such as swelling, interfering with eye opening, record eyes not testable. To assess the verbal response, ask the patient to tell you their name, where they are, and what month it is. If they answer correctly, record orientated. If during conversation the patient is able to speak in phrases or sentences, but is unable to give the correct answers to these questions about orientation, record confused. If they do not talk sensibly, but utter single words, record words. If the patient moans and groans with no recognizable words, record sounds. If the patient makes no sounds at all, then record none. Remember, speechlessness may result from factors other than depressed consciousness. For example, the presence of an endotracheal tube. In these cases, record verbal not testable. To assess the motor component of the coma scale, first ask the patient to perform a 2-step action by asking them to grasp and release your fingers with their hand, or opening their mouth and sticking out their tongue. If the patient does this, record obeys commands. If the person can't move their arms, for example because of a spinal injury, you should ask them to open their mouth and stick out their tongue. In a patient who does not obey commands, a peripheral stimulus alone is inadequate to assess the motor component of the coma scale, and an additional central stimulus is needed. This is first applied by the trapezius pinch. To perform this, place your hand over the patient's shoulder and press your fingers into the muscle above the shoulder blade. Apply pressure with increasing intensity for up to 10 seconds until you are sure that the response you observe is the patient's best response. The second location for central stimulus is the supraorbital notch. Apply this stimulus if there has been no localizing response to the trapezius pinch. This stimulus is applied by placing a hand on the forehead with a thumb over the upper rim of the orbit. Feel for the notch in the supraorbital margin. Apply pressure with increasing intensity for up to 10 seconds until you observe the patient's best response. The patient should not be rated as having an absence of response until the maximum stimulus has been applied. This stimulus should not be used on patients with facial injuries adjacent to the supraorbital notch. If the patient moves their hand above their clavicle or collarbone in an attempt to move the stimulus away, record localizing. If their upper limb does not reach above the clavicle but does flex, then they are either normally or abnormally flexing. In clinical practice, the assessment of these non-localizing responses is based on a combination of both peripheral and central stimulus. In normal flexion, the elbow bends and the arm moves rapidly away from the body and from the stimulus. In abnormal flexion, the elbow bends slowly and the arm comes across the body. If in doubt, record normal flexion. If the patient extends their elbows rather than flexing them, record extension. A patient who makes no response is recorded as none. If they are paralyzed by other factors, such as paralysis by drugs, record motor not testable. If different responses are exhibited between limbs, on right and left sides, record the better side response as the best index of overall responsiveness. The response of the worst side might reflect focal brain damage or local injury. So, to recap, check for factors that might interfere with your assessment. Observe the patient for spontaneous eye opening, speech, and movement. If necessary, then stimulate the patient, first verbally and then physically. Findings should be documented clearly on a coma scale chart. The observations can then be clearly communicated and the trend rapidly appreciated so that any improvement or deterioration in a patient's condition can be seen. Patient ratings can be documented numerically as a shorthand aid to quickly record findings. When describing the patient, always use the full criteria alongside the numbers to ensure that the assessment is accurately understood. The shorthand numbers can also be added together to give a total coma score. This provides an overview summary of the severity of the patient's condition, but this score does not communicate the more informative, detailed description of each response, which should always be used in addition to the score in clinical care of an individual patient. This approach to assessment has been drawn together into a structured summary that you can download from the website glasgowcomascale.org.
All right. So, no, yeah, that's how to assess your Glasgow coma scale. All right. Sige, let's proceed to our um, PowerPoint. Okay, to continue, so cranial nerves naman tayo, no? So, the nurse needs to be aware of the specific nerve functions and assessment methods for each cranial nerves, no? To detect abnormalities. In some cases, nerve is assessed, no? In other cases, only selective nerve functions are evaluated. So, sabi natin kanina, di ba, ilang cranial nerves meron? So, we have 12, no? So, do you still memorize the 12 cranial nerves? So, we have, let's count them, no? So, we have here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, no? So, alam niyo pa ba yung ano ninyo, yung mnemonics ninyo? So, ang mnemonics na gamit ko is yung O, 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 to touch and feel, virgin girl's vagina, such heaven. So, yun talaga yung ano ko, no? So, paano mo malaman kung ano itong mga ito, no? So yeah, you got to have your guide, no? Para sa akin, ang guide ko is yung drawing, no? Para malaman mo ano ba yung unang O, sir, sa ilong ba yan, sa mata ba yan? So the drawing is my guide, no? So ito yung drawing ko. I made my own drawing. So 1, 2, 3, oops, sorry, 3, ayun, ano nangyari? 3, 4, 5, 6, 7, 8, 9, 10. Meron palang 7 dito isa. 7. Inverted 7. 11, 12. No? So, yan yung drawing ko. So, ano ba ito? You have your, so number 1, ilong. You have your olfactory. Factory. Then 2, optic. Oculomotor. Oculomotor. You have your trochlear. Trigeminal. Abducens. Facial. Vestibulocochlear. Glossopharyngeal. vagus, spinal accessory, and then hypoglossal. Yan. Now, functions. For the functions naman, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Huh? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So, for the functions naman, we have, ang mnemonics ko dito is, some say money matters, but my brother says big boobs matter most. No? So, this is sensory function. This is motor function. This is both. No? Yan. So, that's how you memorize. No? So, for the assessment naman, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So, for the olfactory, you smelling test, no? Smelling test, you allow the client to smell something, no? Closing the eyes, and then covering one nostril, no? So, make sure na to avoid, tawag na to, letting the patient smell strong odor such as bleach, mga muriatic acid, vinegar. Ayaw na siya ipasimhot sa patient kay strong kaayo na siya. Optic nerve, we have your Snellen's chart or your E chart for those who are illiterate. Oculomotor for the 3, 4, and the 6, no? You have your 6 cardinal field of gaze. So, ano yan sila? Pack 1, pack all na sila. 3, 4, and 6, no? For the trigeminal, you have your assessing for the sensory of the face, no? So we have 3 branches of the trigeminal nerve, no? So 3 branches. You have your ophthalmic branch, you have your maxillary branch, and you have your mandibular branch, mandibular. So dito, sensory, no? Sensory test. Then dito naman is clenching of the mouth sa mandibular, right? For the facial naman, you let the patient do facial expressions such as raising eyebrows, puffing cheeks, smiling, ganyan. So, those are the facial expressions. Also, ang taste part nito, no, is the tip of the tongue, this one. So, sweet, no, sweet. And the vestibulocochlear branch naman is divided into two. You have your vestibular branch and your cochlear branch. The vestibular branch is responsible for balance, which is tested by your Romberg's test, no? And then you have your cochlear branch, which is tested by Weber and the Rhines test. Using your, ano bang ginagamit sa cochlear test, branch, no? So you have your tuning fork. Yan. Now for the glossopharyngeal also, this is the posterior part of the tongue, which is bitter taste, and also for swallowing, no? Swallowing. And also vagus nerve is also both for swallowing and for talking, no? I-assess mo dito yung hoarseness of sound. Yan. Also, spinal accessory, you will test through shoulder shrug, no? So, you put your hand here, tapos isa ka sa patient ang iyang shoulder. Hypoglossal is the movement of the tongue. So, you ask the patient to move his tongue upside down, side to side, no? So, basically, that's how you assess your cranial nerves, no? So, this is, again, a very basic, back to anatomy. I hope na memorize nyo na lahat ng ito. Okay? Now, let's talk about reflexes. When you say reflexes, they are automatic response. Ibig sabihin, not voluntary and or unconscious sila. So, ibig sabihin, involuntary sila. Right? Now, we have a very common reflex called the deep tendon reflex, no, which is activated when uh, tendon is stimulated or tapped, no, or tawag dito is the DTR, deep tendon reflex, no, stimulated when the tendon is tapped, no. So as the patient ages, no, habang tumatanda, the reflex becomes less intense, no. So bumababa din yung reflex natin, no? So we have here, reflexes are tested using a percussion hammer. What is a percussion hammer? This is a percussion hammer. All right. Then the response described on a scale of 0 to 4. No. So what do you mean by 0 to 4? You have 0 for no reflex response, +1 minimal, no, or hypoactive, and then you have your number 2, which is the normal response. So ito yung gusto natin na response, no, number 2. Number 3 is more active than normal, but number 4 is hyperactive na masyado. All right? So number 2 ang gusto natin. Now, hindi naman nurses talaga ang gumagawa ng or nag-a-assess ng deep tendon reflex, no? It is usually the mga specialist or mga doctors. So what nurses do usually, we test for the Babinski reflex or the plantar reflex, no? So which can indicate a possible spinal cord injury. All right? So when we check for adults, no, for adults, ano sa tingin nyo ang abnormal, no, o ang abnormal? Number 1, yung mag-fan out, or number 2, yung mag-fan in, no? So type in the chat box, ano sa tingin ninyo ang abnormal, no? Or pag sinabing abnormal, positive Babinski reflex, ibig sabihin abnormal, or merong spinal cord injury. Pag ganyan nyo sa hammer or sa edge ng hammer, ano ba, magfa-fan out or magfa-fan in? 1, 2, 3, 4. Unom na iyang kumagko. Fan out or fan in. Saan ang abnormal? Alright? So, the abnormal is your fan out. No? Fan out ang abnormal. Yan. Sa adult. Pero pag sa infants, baliktad. Infants. So, pag nag-fan out sa infants, that is your normal. Pag number 2 naman, fan in sa infants, ibig sabihin may spinal cord injury or may lesions, things like that. Okay? Let's proceed to motor functions. So, motor functions, we have neurologic assessment of the motor system evaluates proprioception and the cerebral function. So, what does this mean? Ano bang trabaho ng motor functions sa ating brain? So, it involves or ano ba yung mga responsible na organs? We have the proprioceptors na tinatawag. We have our posterior column of the spinal cord. We have our cerebellum, no, and the vestibular apparatus of the ear, no, or yung cranial nerve 8 natin. Ano bala ang ibig sabihin ng proprioceptor? So, ibig sabihin nito, they are sensory nerve terminals that occur chiefly into the muscle, tendon, joints, and the inner ear. No, dito, ito yun sila, mga proprioceptors, no? Sa ears, no? Sa muscles, yan. So, anong trabaho nila? They give information about movement and position of the body. So, ito sila, they are sensory nerve terminals that give information about the movement and position of the body. All right? That's why we are able to move accordingly and maintain balance. Now, the cerebellum naman is part of the brain dito banda sa likod, no? So we have here, it helps for control of posture, acts with the cerebral cortex to make the body movement smooth and coordinated, and control skeletal muscle to maintain equilibrium. Alright, to maintain equilibrium. Yan yung trabaho ng cerebellum natin, no? So, balance and coordinated movement. Alright? Sensory functions. So, sensory functions include the first three are routinely tested, no? So, we have touch, pain, and temperature. Sila yung mga tinetest parati. Others are position and tactile discrimination. Now, saan ba nagtitest usually ng touch or pain? It's usually in the face, arms, legs, hands, and the feet, no, of the patient. Now, pwede naman all parts can be tested naman, no, but the common one is the arms, legs, face, hands, and the feet. No, yun yung common. All right? So, if the client complains of numbness, no, peculiar sensation, or paralysis, the practitioner should check sensation over the flexor or the extensor surface of the limbs, mapping out the abnormality by examining every 2 centimeter to 1 inch area. Saan ba tong flexor or extensor? So, this area, sa may kamay, sa forearm, this is your flexor. And pag nakasupine, nakapronation naman, your extensor area. Alright, dito na area. So, dyan kayo mag-assess if there is possibility of numbness or any other sensations. Now, pag sinabing loss of sensation, ang tawag dyan is anesthesia. No? Pag sinabing loss of sensation, anesthesia. Pag sinabi naman more than normal, no? More than normal, ibig sabihin hyperesthesia. No? Hyperesthesia. Pag less than normal, hyporesthesia. Right? Less than normal, hyporesthesia. Then, pag abnormal sensations such as burning, pain, or electric shock, ang tawag naman dyan is paresthesia. Alright? So, ano yung apat natin? Let's try to write it down. So, you have a loss of sensation. You have your anesthesia. Then, pag more, no? More than normal, hyperesthesia. Then we have your less than normal, you have your hypoesthesia. And then pag abnormal, you have your paresthesia. Alright? So yun yung apat na yun. Alright, now let's continue, no? So, what is the importance of assessing your neurovital signs, no? So, neurovital signs, di ba? When you'll be assigned in the ICU, you will be taking a lot of neurovital signs. Minsan, Q15 every 15 minutes, every 30 minutes, every hour, every 2 hours, no? Every 4 hours, yan. So, kadalasan talaga, mas maikli yung interval pag neurovital signs kasi close monitoring yung pasyente. So ano bang ibig sabihin ng neurovital signs? First is what are the 5 common vital signs? Can you chat in the in the chat box? Can you type in the chat box? Ano yung 5 common na vital signs yung tinitake natin, tinitake ninyo sa pasyente? Alright? Sige. So we have our BP, our RR, heart rate, temperature, and pulse rate and temperature, no? So hindi naman masyadong common yung pain scale or yung pain ng pasyente, no? So hindi yan siya masyadong common. Ito lang talaga yung common na vital signs. Now, ano pala ang purpose ng pag-assess ng vital signs? Para saan pala itong vital signs? Okay, can you type in the chat box para saan yung vital signs? What's the purpose of vital signs? Doctor's order kasi yan, sir. O, ano ba yan? So, it is actually to obtain, all right, baseline data of your body's basic function. So, meron tayong baseline data, no, para sa patient natin. All right? Now, ngayon, what is neuro? Ibig sabihin, neurological status or focus on the neurological status. So, neurological status, no? Vital signs. So, ibig sabihin, what is the importance of assessing your neurovital signs? Oh, okay. So, it is to obtain baseline data of your body's basic neurological function. So that is your neurovital signs. All right. Now, how to perform this one, no? So perform the assessment, no? So you have to introduce yourself and verify the client's identity using agency protocol. Explain to the client what you are going to do, why it's necessary, and how to participate. Discuss how the results will be used in planning further care or treatment, no? So we have, paano ba introduce? You have to introduce yourself and the clinical instructor, no? So we have, good morning, ma'am. Good morning, sir. I am, for example, your name, I am, let's say, Francis. I am Francis, a level 4 nursing student of Davao Doctors College. I am with my clinical instructor, Sir Fiel, no? So I will be assigned to take care of you from 7 a.m. to 3 p.m. May I know your name po, no? So sasabihin ng ni patient, so my name is John Lloyd. John Lloyd, John Lloyd. Yan. So what's your birthday? Sabihin niya, January 1, 1989. All right. So, how do you verify na tama ba itong pangalan ni John Lloyd at saka birthday niya? You will verify by checking the wristband of the patient dito banda, no? Nakasulat naman 'yan sa sa wristband ng patient. All right? Nakasulat 'yan sa wristband ng patient yung mga details na 'yan. Okay? Next, perform hand hygiene and observe other appropriate prevention procedures. Provide for client privacy. Again, so pag sinabing hand washing, no? Pag sinabing hand washing, mayroong water flow, may water. Pag sinabing hand hygiene, no? Hand hygiene, pwedeng alcohol or sanitizer. Importante lang, no, basta alcohol is, yung nga sabi ni ma'am, is 60% to 70% alcohol. But ideally, we would want 70% alcohol. Excuse. Okay? Now, next is provide privacy. If nasa ward kayo, you close the drapes. No, the drapes. If sa private naman, you close the doors. All right? So, it requires the client when you're getting the history, you have to assess, no, the presence of pain in the head, back, extremities, etc., etc. So you also have to assess, no, or gather information, no, to the client. All right. Now let's proceed. So this is the NVA sheet, no. So if hindi pa kayo nakakita nito, so this is the NVA sheet. You have to accomplish this, no. Ano yung uunahin yung accomplish dito? So you have your uh, name of patient, birth birth date of birth, age, sex, room number, and attending physician. So dapat unahin nyo yung headers. So I will just close my itago lang na ako ang face. So I will close my camera so that hindi siya makasagabal sa PowerPoint, no? So as you can see, merong headers dito. So you have to answer the headers. Ito siya. Patient name, date, sex, age, room number, and attending physician. No, for example, the patient's name is Juan de la Cruz. Juan de la Cruz. Date of birth, January 1, 1989. Age, 33. Sex, male. Room, 401. Attending physician, Dr. Strange. Yan. So, parati dapat mag headings. All right? Sige, headings. Now, in assessing for size of pupil. So, sa likod ng paper ninyo, makikita nyo doon, meron kayong cheat sheet nito or dito, banda, this is the one, no? So, kung ano yung size. So, you have your pinpoint 2, 4, 6, 8. And then, if it, you will assess the contraction, the constriction of the eyes, no? Ito, this is the pupil, no? The black one, no? So, it can be brisk, fixed, or sluggish, no? Brisk, fixed, or sluggish. All right? So, ganyan. So, I will let you see a video paano siya i-assess, no? So, paano siya i-assess. Let me just stop sharing sandali. And I'm just trying to find the video. Okay. So I'm just going to share my screen. All right.
The next test we're going to do is actually look at the pupillary light reflex. The afferent limb for this is going, or the sensory limb is going to be the optic nerve, and the efferent limb, or the motor limb, is going to be the oculomotor. And so what we want you to do is just take and look right there, and I want you to, again, just keep looking over there. We look at the direct as well as the consensual. We're here to the direct and consensual, both coming out equally. And now we're going to do the swinging flashlight test. We're going to go from one eye to the other eye, back and forth. Both pupils stay down. There's no evidence for a deafferented pupil or a sensory defect. So that's good. That's fine.
All right. So that is your how to assess, no, your pupils. All right. So, yan. Examples, the normal size of a pupil is your 2 to 5 millimeter, no? So, 2 to 5 millimeter. Then, pag meron tayo ditong pag dilated ang both pupils, possibility for aneurysm. And then, we have a clustered headache naman pag constricted ang pupils, no? So, we have glaucoma for mild dilated pupils, no? And then, unequal size pupils, so, or also your anisocoric, no? Anisocoric, ah, maliit yung isa, malaki yung isa. That's possible for head trauma. And then we have your syphilis, no? Small pupils that constrict poorly directed to light, no? So that's your syphilis. Right? Now, so paano ba natin isusulat dito? For example, again, write your headers, no? So Juan de la Cruz, then date of birth, January 1, 1989. 33 years old male, room 401, Doctor Strange, no? Yan. So date is, ano bang date? You have your 8/12/2022. Then frequency, you have your, let's say, ngayon, you have QRly, for example, 11 a.m., 12 p.m., 1 p.m., 2 p.m., for example, no? So again, pag sa Davao Doc, pag morning shift or PM shift, you have your black or blue ball pen. Pag night shift naman, so you have your red ball pen. Alright? So, sa akin, kasi red lang yung pwede dito. So, you have to change that. Black dapat, no? So, we have size. So, for example, 2 ang sa left, tapos 2, lagay nyo yan 2. Ang reaction naman, kung brisk naman, lagay nyo yung brisk, B, no? So, kung 4 naman, lagay nyo 4. Kung sluggish, lagay nyo S. Yan. So, for example, kung 6, tapos fixed, no? So, dapat i-refer nyo na yan. No, baka nag-seizure na yung pasyente ninyo or nag-arrest na yung pasyente ninyo. Alright? So, yan. Okay, let's continue. For the hand grip naman, and leg movement, yung ganito yan. So, kung mapapansin niyo, this is the right of the patient, right of the nurse, and right hand of the patient. So, dapat right to right, tapos left to left, no? Ideally left to left. Kasi nga this will allow you to parang feel the patient's strength, no? Right to right, left to left. And then for the leg naman, you put a resistance, no? And sabihin mo, ma'am, can you raise your leg, no, with resistance? Assess mo kung strong, moderate, weak, or absent. And then pag pababa naman, you can also put resistance sa baba. Right? So I will show you a video later. Okay? So dito, paano siya isulat? Again, write the headers. Then we have for example, 11 pa rin tayo dito, no? So sulatan ko na lang dito So hand grip, sabihin na nating strong, strong yung dalawa, then leg movement is also strong. Pag moderate naman, sulat yung M, moderate. Yan. Pag weak, lagay yung W, weak, no? For example, 12 p.m., 1 p.m., 2 p.m. for example. Sir, pwede ba na, no? Strong yung left tapos weak yung right? Pwede, no? Strong tapos weak. Baka pala meron siyang right-sided paralysis, no? Or right-sided weakness. Alright? So, yan. Okay, so let's continue. Now, in GCS naman, in your Glasgow Coma Scale, so na-discuss na natin to. So, you just have to tingnan nyo lang kung ano yung response ng patients to the level of consciousness, no? So, hindi ko na-explain ito kasi na-explain naman siya. Now, merong iba-ibang ways to what you call to answer this, no? So, you have to write this in the charts in the Davao Doc, no? So, ano daw, check lang ilalagay. For example, spontaneous, check natin, and oriented, and obeying. So, lagay lang tayo ng total dito, 15. Sa next shift naman, 3, 4, or 5, no? So, ganyan yung result. So, i-total nyo lang, 3 plus 4, 7 plus 5, 12, no? Ganyan. Sa ibang hospital naman, ang style nila is nilalagyan talaga nila ng number. For example, 2, tapos sabihin nilang uh, 2, no? Tapos dito naman is sabihin natin 3, no? Then ang total niyan would be your 7, no? So 7. Sulat niya dito 7. Alright? So ganyan. Or sabihin 1, 1, 1, so 3. Yan. May ibang hospital naman, ang style nila is parang ganito, no? So sabihin natin 4, tapos dito 4, tapos dito naman, ganyan, no? So dito, for example, ganyan, oriented, same pa rin yung pattern. Tapos, ganyan, bumababa yung pattern niya. No? So, you have to plot. Okay? So, sulat niyo pa rin ang total. For example, ang total dito, you have your 15 siya dito, 15 hanggang sa naging ano na lang siya dito, 3, 3, 3, 4, ilan eh? 1, 2, 3, 4, 5, 6, 7. So, 7 na siya dito. So, we have 5, 5, 4, 9 plus 3, 12. So, maging 12 na siya dito. So, ganyan, no? So, how you plot it. Alright? So, okay. So, pause muna tayo sandali. All right, to continue, so for the RLS or the reaction level scale, so it's basically like the Glasgow Coma scale, no, but it just focuses on the consciousness of the patient. So ganun pa rin, no, if there are, depending on the institution kung ano yung susundin ninyo. So if alert yung patient, you just check this box right here. So for example, this is part of the 11 a.m., no, 12 p.m., 1 p.m., 2 p.m., no? So just check it. So if confused ang patient, ganyan, no? Meron ding iba na dot, no, or parang yung uh, graph, no, para nakikita kung ano ng status ng patient, for example, ganyan, no, or ganyan hanggang sa baba. So ganyan ang nangyayari. So mga dots. Okay? So ganyan. So that's how you assess for the RLS. But mostly, sabi ni Sir Ivan that the RLS is mostly assessed by the doctors naman din, no? So kadalasan GCS talaga yung parang mga ginagawa natin nurses, no? But still, hindi naman ganoon kahirap mag-check ng level of consciousness, no? All right. Now, for the last part, we have the RR temp, BP, and pulse also. You still have to check this, no? So, sulat nyo lang dito, the RR, for example, 12, temperature 36.5, Blood pressure is 120/80, ganyan. Then pulse is 100. Sulat nyo lang din yan. Now, this is still part of the vital signs. Alright? So, let's have an exercise, no? So, kayo dyan, answer kayo, no? Ano yung ano yung isusulat natin dito, no? Tapos, type nyo sa chat box. Alright? So we have here, you are assigned in the ICU and are taking care of patient in room 401, Paulo Vinto, 33 male, born on July 12, 1989, under the service of Dr. Leo Cardo, diagnosed with hemorrhagic stroke. Upon going inside the room, the patient, you notice that the patient is unconscious. No? You greeted the patient and the patient was unresponsive. When assessing the pupil size, you notice that the eyes have 4 millimeter dilation and showed sluggish response to light. Upon assessing hand grip and leg movement, patient showed no response. No? When applying pain to the patient localized to pain. When checking the vital signs, the results were 110/80, 112, and 36.5. Alright, so anong uunahin natin? Type kung ano yung uunahin natin. Type, anong uunahin? It's your headings. Headings yung una. No? So, patient's name, we have yours, Paulo Vinto. Vinto, date of birth, you have your July 12, 1989. 33 years old, male, room 401, under the service of Dr. Leo Cardo. Alright? So, sabihin na natin 8/12, no? So, 8/12, 2022. So, i-fit nyo lang sa box, no? Kasi maliit masyado yung box. So, let's say, anong oras na ba? 11 a.m. pa rin. So, ano isusulat sa pupil size? Left and right? So, you have, type in the chat box, ano isusulat? Pupil size. When assessing for the pupil size, you notice that it has 4 millimeters dilation. No? So, 4, isusulat dito 4. Yan. Both eyes are 4. Reaction naman. So, showed sluggish. No? So, susulat natin S. S. Then, hand grip. Ano daw ang hand grip at leg movement? Showed no response. So, anong isusulat? You have your A for absent. No? So, lagyan dito A, 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 A. Now, eye opening for the GCS. Ano ba yung eye opening niya? 4, 3, 2, or 1? So, sulat nyo. 4, 3, 2, or 1. Anong eye opening? So, when you're going inside, you notice the patient is unconscious. Therefore, it is none. Diba? Kasi wala. Close ang eyes. Ay, hindi pa pala. None. Pero, upon applying pain, nag-localize sa pain, wala pa rin. Hindi talaga siya nag-open ng eyes, no? So none. 1. So best verbal response, nag-response ba siya? Wala din, di ba? So 1. Then to pain, localize. So dito 5. So 115, total of 7, di ba? Tama? Wait, sorry. 7. Therefore, kung 7 siya, anong status ng patient? Diba? 7 or less, ano yan siya? Tawag dyan is comatose. Comatose ang patient, kaya hindi siya nagigising, no? Now, sa RLS naman, so localizing, so dito siya sa localizing. Yan. Then respiration, 12. Then temperature, 36.5.5. Then blood pressure is 110/80. So make sure na nasa loob ng box, okay? Then pulse rate is 100. Yan, sulat nyo dyan. Okay? So nakuha ba? Let's try another exercise. Another exercise. Okay, ready na? You're in the ICU and you're taking care of a patient in room 402, Sheila Pagwa, 33 years old female, born on June 12, 1989, under service of Dr. Mimero, diagnosed with stage 4 breast cancer. Upon going inside the room of the patient, you notice that the patient is conscious. You greet the patient and the patient is responsive. When you ask the patient's name, birthday, and location, she was not able to answer correctly and seemed to be confused. When assessing the pupil size, you notice that both eyes have 3 millimeter dilation and showed brisk response to light. The patient was able to obey instructions such as gripping the hands and moving the legs with moderate strength. When checking for vital signs, the results were 120 over 80, 110, 14, and 36.9. Alright, anong unahin? Anong unahin? Yes, very good. It's your headings, no? So headings, so we have Sheila Pagwa. Birthday is June 12, 1989. 33 years old, female, room 402 under the service of Dr. Mimiro. So again, let's say 11 a.m. pa rin, 8/12/2022. So size of the pupil, both are 3 millimeters. So sulat natin 3. Alright? Then reaction, anong reaction natin? Anong isusulat na letter? Okay, type in the chat box. Anong isusulat na letter? We have letter B for brisk. No, brisk. Leg movement and hand grip are moderate. So ano isusulat? Okay, moderate is M. So M, 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 M. Then eye opening. Anong eye opening natin? So upon going inside, the patient is conscious. So nakita mo, conscious ang patient. 4. Then verbal response, responsive naman yung patient, no? So, pero ang problema, confused ang patient sa sagot niya. So the answer is also 4, no? So 4. Oh, sorry. 4. Oh, what happened? Bakit? Okay, 4. And then, how about best motor response? So, dahil nakaka-obey naman siya, so 6. So, ano natin? 14, no? 14. Then, kasi confused siya dito, ang ano niya, sa number 2. Then, respiration is 14. Sulat natin dito 14. Temperature, 36.9. Then, you have your blood pressure is 120 over 80. And then, PR is 110. Alright? Yan. So, di ba madali lang? Okay, last exercise. Last exercise. You are assigned in the ICU and are taking care of patient in room 403, Andrew Engla, 33 years old male, born on April 19, 1989. Under the service of Dr. Shimezo, diagnosed with systemic lupus erythematosus. Upon going inside the room of the patient, you notice that the patient is conscious. You greeted the patient and the patient is responsive. When you asked the patient's name, birthday, and location, she was not able to answer correctly and seemed to be inappropriate. When assessing for pupil size, you notice that the left eye lang pala, no? Left eyes. Marami siguro siyang eye sa left. Left eye has 3 millimeter dilation and the right eye has 2 millimeter dilation. And both showed sluggish response to light. The patient was able to obey instructions such as gripping of hands. The left side is moderate strength. The right hand is weak. With moving the legs, the left having moderate strength and the right having weak strength. When checking for the vital signs, the results were 120 over 80, pulse rate 110, RR 14, temp is 36.9. Right. So again, anong unahin? We have our headings. No headings. You have Andrew Engla. So no erasures tayo guys pag sa chart ng patient, no? Very important. April 19, 1989, age 33, male, room 403, under the service of Dr. Shimezo. Alright, so 8, ano pa rin tayo? Dito to isusulat sa space na to, 8, 12, 2022, then 11 a.m. Alright, so size ng pupils, sa left, we have 3, and sa right, we have 2. So lagay nyo dito, 3 sa left, and then, 3 sa left, and then 2. Reaction naman, both are sluggish. So, sluggish, S. Sulat na S, S. Then, hand grip. Sa left naman is moderate, and sa right is weak. Sa paa naman, left is moderate, and the right is weak. So, left, moderate, right, weak. Left, moderate, right, weak. So, upon assessing for consciousness, conscious naman siya, spontaneous, 4. Pero yung verbal response siya is inappropriate. So we have 3. then obeying naman siya sa instructions mo. So we have 4, 3, and 6. So that makes it 13. Diba? So dito naman sa RLS, since mapapansin nyo sa verbal response, nasa ikatlo yung confused or inappropriate, lagay na lang natin dito siya sa number 3, no? Sa number 3. Alright? Or you can clarify with the doctor kung saan niya gustong ipalagay. But basically, hindi siya alert, no? So, hindi naman din siya unconscious. So, dyan lang yun siya banda. Temperature, respiration, you have your 14. So, let natin ito 14. Temperature, 36.9. Blood pressure is 120/80. And then you have pulse is 110. Alright? So, yun yung NVS natin. Okay? So, I think that's all, no? Thank you for your participation. So, do you have any questions so far? No? Any questions? Thank you. And God bless, no?